Okay. Good morning, everyone.
It gives us this number 2.6. So to date, there
All right. Hafa good morning, everyone. And if you notice, we're now calling this a DPHSS COVID-19 brief. We do have Dr. Ann Pobutsky with us this morning. Also joining us is and of course, Dr. Ann is our territorial epidemiologist with the Department of Public Health and Social Services. Also joining us is our interim chief medical officer, Dr. Leon Guerrero, and our Bureau of Communicable Disease Control Administrator, Annette Aguon. So again, thank you. Apologies for a slight delay. Dr. Ann will present COVID-19 data analysis. And then of course we have Dr. Bob again and Annette Aguon. After the data analysis presentation, Dr. Bob will just give a brief statement as well as Annette Aguon, and then we'll go to our question and answer round. One round of questions, and then if you can, go ahead in the chat box, please list your name and the media organization that you represent. And I'll call upon you, of course. So go ahead and the floor is yours, Dr. Ann, for your data presentation. Thank you.
This is today's report on the trends. This is approximately a month worth of data. We're averaging about 700 plus tests per day, but the positivity rate has gone down, which is really, really good. Everything's on the decrease. The number of cases per day continues to decrease. We're now below 40 cases per day. We'd like that to get even smaller, like we were back in March and April, where it was like 5 to 10 cases a day. The CAR score is below 5, and the 7-day rolling average of cases, again, has gone down to less than 40 per day. All age groups are showing continued decreases along with the cases. The one group that's still a little high is that 0 to 11 age group, because they're the last group to be vaccinated, the 5 to 11. I know we're going to talk about that later. The island-wide hospital COVID count has also shown a noticeable decrease in the past couple of weeks. And definitely in November, we're seeing less people in the ICU, and we're also seeing less deaths. But deaths still occur because some people are still hospitalized and some of them die. This is what the entire death count looks like for July 8th through the 18th. This includes the 2 deaths that we will report today. They have been decreasing, and we have not seen any more dead on arrival since the 6th, more than 10 days ago. During this surge, approximately 43% of the COVID-19 related deaths were dead on arrival, but almost 2/3 were not, well, more than half. This is why the CDC team is out here assisting us in the investigation on these dead on arrival cases. And we also are seeing a kind of a up and down with the symptomatic versus asymptomatic. We recently saw a big increase that was similar to what we saw in October in symptomatic cases. So we're continuing to look at this. And there's a continued decrease in cases among both vaccinated and unvaccinated. But as you can see, the being unvaccinated is a much lower risk. It's 3 times more if you're unvaccinated. That's it for today.
Okay, great. Thank you so much, Dr. Ann. I'm just going to go ahead and turn the floor over real quick to Annette. She just has some information she would like to share. Go ahead, Annette.
Thank you, Janella. Hafa all our partners. So as of yesterday, we've already immunized 1,281 children between the ages of 5 to 11. We currently still have just over 4,500 doses of the Pfizer pediatric vaccine available. And again, as we continue to administer more vaccines and show that to CDC, then we'll be able to place another vaccine order for pediatric. And, always being cautious, right, about how much vaccines, especially that we're still in typhoon season. So we definitely don't want to have, too much vaccine in stock and then we worry about power outages or a storm. But we always have that opportunity to order, and it takes about 5 to 7 business days. And we have been very fortunate, no issues with our vaccine shipments. They have all been received in good condition for the past several months. We currently have 10 public and private providers offering the pediatric vaccine. And this is in combination with the other vaccines for the adolescent and adults. Some have already started administering. And then we've had a couple of our partners pick up just yesterday. So they'll be launching their respective pediatric clinics at their set times and dates. We do have 5 more partners who have committed to providing pediatric vaccines. We are just working with them on, final setup and when they want to pick up their vaccine. So again, that will increase the number of partners and locations where individuals can bring their children to be vaccinated, as well as themselves, because we really want to push out. Now it's a family affair for 5 years of age and older. Please come get vaccinated, get your booster or your additional dose if you need it, and help protect each other and our island. I think those are the main one I have. Thank you, Janella.
All right, thank you very much, Annette. And I'll turn over the floor to Dr. Bob for his remarks. Thank you.
Good morning. I just want to, I can't stress enough what Ms. Aguon was reiterating about the vaccines. Right now, we're on a downward trend, which is good, but we're not at the point that we'd like to be. And now we're starting to see in Europe and in the US, and normally we follow suit. They're having increased cases of COVID-19. And it's mostly the people that are unvaccinated, but it's also people that have been vaccinated but need the booster shots. So I can't really stress enough how we still need to be proactive in doing the things like wearing the mask, washing, social distancing, but more importantly, getting vaccinated. And if you haven't gotten vaccinated in over 6 months, especially if you're in the high risk group, please get your booster shots. And then we're trying to push out for the 5 to 11-year-olds. Now, they don't usually get that sick, but they can help spread the COVID to more potentially dangerous individuals or people that are more dangerous, like their parents, their grandparents. So we're trying to really push out. I've noticed in the past several days that when I see patients in the public health, I talk to the parents about immunizations, and they basically, and this is their words, we didn't know about the vaccinations for the 5 to 11-year-olds. So for some reason, they're not getting the message. And I really am asking our partners in the news media to maybe really push out that there's vaccines available for 5 to 11-year-olds. And they're very, very important in help decreasing the spread of the COVID. And hopefully that we won't have the surge like it's starting to see in the States, like they're starting to see in Europe, that we still stay at a lower rate. But I think we need to get these guys vaccinated, and we need to get out the message that you can get vaccines. And then also the boosters for the people that are over 18 with health issues, that they get their shots, the booster shots, if they haven't had one in over 6 months. Thank you.
Thank you so much, Dr. Bob. We'll move to our question and answer round. We'll begin with Polly Suba with K57.
Thank you. I guess the question is to Dr. Bob, since you just talked about eligibility for booster shots. When will DPHSS put out, or the administration put out, the guidance for everyone to get the booster shot that's eligible, 5 and older? Because anyone age 65 years and older, anyone younger than that, if they're not employed in these businesses, they don't have the green light to go get vaccinated or get the booster shot?
That's a good question, and we are having some problems with that. Unfortunately, we're getting our vaccines from the CDC, so we have to follow the CDC's guidelines. The standing order that I wrote incorporated the CDC's guidelines about booster vaccines. I'm under the understanding that they might be meeting later on this week, and they might open it up to anybody that's over 18 to get the booster vaccine. But until that happens, we need to follow their guidelines. As they're the ones that are giving us the vaccines. I've heard that they've been coming down hard on the immunization department about. They're hearing rumors that we're just giving it to anybody that's 18 and above, and that they told us basically to cease and desist, and that the only ones that should be getting the boosters are the ones that are over 6 months since their last for the Moderna and the Pfizer, or over 2 months if they got the Janssen. If they're 18 and over, or 65 and older, no problems, or with problems, it doesn't matter. 18 and over, so the 18 to 64, only if they have underlying health issues or in job capacities where they come in contact frequently with people that are potential carriers of the CDC, having the COVID virus. And so anybody that's not in that criteria, we're told we cannot give the booster as of yet. Again, I think they're meeting at the end of this week, their time. So we may have new guidelines, but until then, we have to follow what they are saying. And like I said, they did come down hard on us for giving or thinking that we gave anybody and everybody. So, and then of course the 5 and 11-year-olds, they haven't even gotten the first shot, so they can't get a booster yet.
Right. Who came hard on you, and what is
CDC.
The consequence? CDC. And what would be the consequence, though,
We get our
of
vaccines
continuing
from
that?
the CDC.
So they would stop giving you vaccines if you continue to do that.
I don't know what they're going to do. Maybe Annette can give you more guidance, information on that.
Okay.
But they just told us to basically cease and desist with this.
Understood.
And I just got that information just a few minutes ago.
Understood.
Thank you.
And then the other question that I have, because it's a completely different question, to stay on mandating vaccines for employees in the continental U.S., is that affecting the administration or public health in the vaccine mandate here in Guam?
You're asking is this okay. So from what I understand, the more cities, the big cities like New York, Los Angeles, San Francisco, they're still requiring vaccines for restaurants and things like that. And I think that's in response to the start. I mean, they did this a while ago, but they haven't loosened that restriction. And I think that's in response to they noticed that the several states have seen an increase in the COVID. And then also Europe is reporting increases in COVID. I think Germany is requiring still that if you want to eat at a restaurant, you need to be vaccinated. If you're not vaccinated, stay home, is their message.
Understood. So we have to wait on our local judicial system for a stay?
If I may add and clarify.
Yes, go ahead, please.
Sorry.
Thank you.
So the case you're mentioning in the States was that the federal government was going to require large companies, private companies, to have a vaccine mandate. That's where the stay is. However, it doesn't stop large private businesses from making their own mandates. So again, private entities can be more strict than a local, state, or federal government for vaccine mandates. And so that's why you're seeing different cases state to state. And as Dr. Bob mentioned, other states, their mandates are still in place because it's respective to their jurisdiction, what is going on with the pandemic, the disease burden. And again, we always work with all partners, private and public. We have our mandates. Private entities, nonprofits can be more strict. They just cannot be below what the government is requiring. So that's the slight difference with the federal mandate, because they were trying to go for large companies, and that's where that stay was. But all other vaccine mandates, as previously passed and accepted or approved, as Dr. Bob mentioned, they are still in place and being enforced.
Thank you for the information.
Thank you, Polly. We'll go to Joe Taitino with PDN.
Happy Thursday, everyone. Thanks for fielding all our questions again. Maybe I'm not too sure. Maybe this is a question for Dr. Bob or Dr. Ann. Some of the local physicians have expressed concern that, we've been pushing for the booster shots, but it seems like the population maybe just doesn't understand the need for getting them. After we recommend after 6 months, but for the average person who says, "Hey, I'm fully vaccinated, I don't really know why I need to get the booster shot." Could we maybe get like just a clearer explanation to kind of connect the dots for people who maybe don't really know why they should go and get it at this point?
Well, there are now more and more studies coming out showing that after about 6 months, especially the high-risk individuals like 65 and over, people with chronic diseases like diabetes and high blood pressure, their immunity towards to the COVID-19 when they have received 2 doses of the mRNA or 1 dose of the Janssen has been shown to be actually waning, and that's why the booster is required. In Europe, they're saying that their consideration is that you're not fully vaccinated unless you get the booster. So they're a little bit different, and that's because of, like I said, that out in the European countries, they're starting to see an increase in COVID, and especially in those people that are not that haven't gotten the booster shot. So again, the problem is the waning immunity, where the people who have had shots, what they were considered as fully vaccinated in the past, is now we're noticing that after about 6 months, their immunity has actually decreased to the point where they're able to get the virus despite the fact that they received 2 doses or the 1 dose of the Janssen. Thank you.
Is there any consideration on those lines about changing, and I'm not talking about like restrictions and things, I just mean like the way we think about it in public health, about changing kind of that fully vaccinated definition, especially considering that we know on Guam, the comorbidities are so high and people's immunity might be waning a little faster than some other locales.
Well, that's another good question. And in fact, we were at the governor's meeting this morning where we mentioned that, so that the governor is going to be sending a message or a letter out to the CDC in regards to this particular problem. And so we'll just have to wait and see what they say in response to the letter that is being sent out. Thank you.
I'm sorry, as far as that consideration, what exactly are we asking for from the CDC along those lines?
We're asking if we can first not just give the boosters to the 18 to 64 who are at high risk because of their underlying health problems or the job that they have that exposes them to people with COVID. The 65 and over is no problem. It's anybody that's 65 and over that gets the booster. So we're trying to see if we can, because like I said, our standing order is written such that we follow CDC's guidelines, and it's fairly detailed in that anybody 18 to 64, if they don't have any underlying health issues, it's not recommended to get the booster as of yet. And again, they're going to meet later on this week, so that might be a moot point. They may just say this: anybody 18 and over to get the booster if they haven't had a shot within 6 months with the mRNA, or 2 months if they haven't gotten the Janssen. Thank you.
Real quick, just one last question. I know, I think the latest JIC says we got about 20,000 people who have gotten their booster so far. And we were real early to get a lot of our population vaccinated. Are we concerned at all? I know you're saying there's surges in other places about having another one here if we are not able to get a good portion of the population boosted.
Well, and that's, again, that's a good comment too, is that a lot of people, from when I have discussed this issue with them, they are saying, well, I'm fully vaccinated. I've got my 2 shots, so I'm not worried about it. And I guess, if we can just get that message out to them, that it's not especially for those that are at risk, the 65 and over, and the 18 to 64-year-olds who are at risk because of their job, that they're exposed or their underlying health problems. That their problem is that the immunity is not as strong as when they first got the shots. And that's a problem because we were really hyper about getting those vaccines. And now we're starting to see a little bit more problems with those people that they thought they were fully immunized, but they're currently not. So, again, if our media partners can bring out the message that, yes, we were good for a while, but that there's a waning immunity for those that are over 65 and those people 18 to 64 with underlying health problems. They may not be as protected as they thought they were, as we thought that they were going to be. That we're now seeing studies showing that because of the decreasing immunity, they're more at risk. And so please come in and get your boosters. So if we can spread that information out through you folks, our media partners, it would be much appreciated. Thank you.
Thank you, Joe. Daniel
Thank you
Paris
very
with
much, Dr.
King's.
Bob.
Yes, hi, good morning, everybody. So I do actually have a question for Dr. Ann. Dr. Anna, I know you've been working really closely with the CDC team that's here. Can you give any updates as to what they're currently doing?
Sure, we are providing our data to them on the deaths and the cases, and especially the dead on arrivals, and they are conducting interviews with the families of people who were dead on arrival. And I believe they're also going to be requesting hospital data. So basically they're in a data gathering phase, and that's going to take a while. There's probably nothing new to report yet. So you guys are just going to have to wait. It's very detailed, and like I said, they're in the data gathering phase.
Thank you so much, Dr. Ann. So I do have one question for Dr. Bob also. So there's been talks about easing restrictions soon for Thanksgiving, Christmas, and so and so. Have you heard anything about that?
As of yet, the requirements are still what's in place. I understand that there might be some lifting of some restrictions, but I don't know that for sure. My guess is that though that they're still going to require that they have at least one dose of the vaccine. But the actual details, I do not really. I don't really know what that's going to be. Thank you.
All right, and I just actually wanted to ask if you've heard anything about the Merck pill or the COVID pill that'll be coming soon to our island.
No, I have no answer to that at this point. Sorry. Thank you.
Okay, Dr. Bob. And how are the MAB treatments going so far?
I'm sorry.
How are the MAB treatments? Are they still going, or have there been?
Oh, the monoclonal antibody treatments you're talking about?
Yes, Dr. Bob.
Yeah, they're still in operation. If you notice, Dr. Ann's data is showing that there's less people that are positive. So obviously, if there's less people that are positive, the monoclonal antibody therapy is also decreasing in the amount of people that they're giving. But it's still an important part of our treatment for COVID. And so my guess is that there'll still be ongoing until the threat is over with. But yes, it's less, but they're still operating.
Right. And do you happen to have how many courses are left for that said treatment?
I don't know exactly the number, but from what I understand is that it's more than adequate amount quantities of the monoclonal antibodies. And if we ever need, we can always ask for more and get it in a timely fashion. So that's not going to be a problem at this point.
All right. And just one last question. Have you been seeing a rise in vaccinated people contracting COVID, and have they received their booster shots?
My guess, because I don't know those exact numbers, but if I were a betting man, if they had the booster, chances are they're not going to get sick to the point where they need hospitalizations or be at risk for dying. The ones that are at risk are those that have had their 2 shots but not have the boosters as of yet. And that's again why I really am imploring you folks in the media to really push out that information, is that they're at risk. They shouldn't be considered fully vaccinated if they're over 65 and hadn't gotten the booster, or if they're 18 to 64 and have underlying health problems or at risk because of the type of job that they do, that they should come and get the booster as soon as they can. Thank you.
Thank you so much, Dr. Bob and Dr. Ann.
Thank you, Daniel. Heidi Gilbert with the Guam Daily Post.
Hi, good morning. My question is to Dr. Ann. How were people placed on and then taken off the COVID-19 related fatality list? I know that in recent days we've seen JIC reports saying deaths have been reclassified. Is the CDC part of this? Is CDC part of that decision to classify or declassify a fatality? Thank you.
No, it's what's happening is we had a backlog of death certificates. It usually takes a couple of weeks before public health gets the death certificates on deaths that we have already reported from people who are positive and died. Then we have to take a look at the death certificate and make sure that there is a COVID related cause of death, either immediate, underlying, or contributory. When that is not there and the physician or the hospital pathologist determines that it's not related to COVID, then we have to take a look at this. We've actually done this several times in the past 2 years. Other times we had to do a detailed death review with the hospital pathologist, the medical examiner, and any physicians involved. Other times we get death certificates that weren't initially reported to us. So we constantly are updating this list. It happens, it's normal. Does that make
Dr. Ann, yes, but Dr. Ann, the backlog on death certificates, is that because DPHS has like limited personnel working on it?
That's at the Office of Vital Statistics. Yes, they have limited personnel and they've been very busy over there. And finally, I have a CDC prevention associate who's assigned here. I had him actually go over there and help them so we could reduce that backlog, because the CDC is here as well. So we finally did play catch up after a month and a half of not getting any death certificates, and we're now good. We also, the Office of Vital Statistics is going to be undergoing data modernization with some of the CDC money that we have. So this process should get better for all involved in the future for Vital Stats. So it's a work in progress, but we work very closely with them. We were getting them regularly, but again, this was a surge, so they were overwhelmed as well. And yes, they have limited personnel.
Follow up. So how soon does the Department of Public Health notify the family about the death? That it's reclassified or not COVID related anymore?
We do not do that. Because if it's COVID related, that's usually with the governor's spokesperson. There's a whole list of people that they take care of, the Department of Administration, and they notify. And then of course the MD would have to notify the family. We don't do that notification.
Thank you. I'll reserve the second question later.
Thank you, Heidi. Next is Jerry Partita with PNC Digital.
Yes, thanks, Janella. My question is, can we expect a surge in COVID cases after the Thanksgiving gatherings? And are we preparing for that? For example, increasing the number of contact tracers and, stuff like that.
Let me just say that we currently have staff from the previous surge that are on top of this. We are watching and observing what will happen. That's all I can say. We can't predict what's going to happen because a lot of this depends on how the community behaves. If they, the lifting of restrictions, it's possible, but what we are seeing is decreasing numbers. It could be that this particular surge is waning and we're just gonna have to wait and see what happens. A lot of this depends on what the community does as well.
Well, Adelup has announced that it plans to lower restrictions probably by next week before Thanksgiving. What do you think? Because Dr. Bob earlier was warning about the surge in cases in the US and in Europe, right? So do you think there'll be a surge for us also because of the Thanksgiving gathering?
I think that's why we're trying to really come out and have you guys push for us, get the message out to get the booster if you're qualified, to get vaccinated if you haven't been vaccinated, and especially to the parents of the 5 to 11-year-olds, please get your children vaccinated. Because, again, the 5 and 11-year-olds they're usually not going to be that sick. If you look at the hospitalizations, it's the pediatric cases is much, much, much less than the adult cases. But they can spread it, and they can spread it to people at risk. So I think that if we get more and more people vaccinated before this, if there's going to be a surge, before that possibility of surge comes to Guam, if we get more people immunized that need to be immunized, we may not see what's happening in Europe. We may not see what's happening in, I think, 13 out of the 50 states. And that's what I'm trying to push for, it's the message to get out is, get vaccinated, and if you got vaccinated, if you're qualified for the booster, get the booster. Thank you.
Okay, and another question is, with our positivity rates going down, right? Can we ask the CDC to lower its travel risk rating for Guam? I think we deserve, our rates are down, way down.
My understanding of how the CDC lowers the rate, it's not just an instantaneous thing. It's not a single shot. What they do is it's actually something that it's over a 28-day period, and it has to reach like really, really low numbers before they lower the risk of the travel risk. And it's not, if today we had no cases, no deaths, everybody was not taken out of the hospital, it won't start that day because it includes previous 28 days prior to today, to if it happened today. So it's not what happens today will determine it's what happens over a month or so period. Thank you.
And one last question.
On the formula for the travel, for the CDC travel, they also base it on a certain formula. So it's Dr. Bob is correct. It's a 28-day period, a previous 28-day period, and there's a formula that we have to meet. So just wanted to add that. Go ahead, Jerry. Sorry,
Okay,
I cut you.
thank you. And one last question is are the big pediatric vaccinations pushing through this Saturday? And how are we doing on that? Are our preparations okay for that? All set?
Unfortunately, we had some problems with GDOE. The only vaccination outreach is the one that's being sponsored by the private schools and AMC. I mean, it's open to the public, but it's they're the ones that are running the show. The ones that we were anticipating to have, I believe, Tietzen and Ukudu. Ukudu, we were told, can't do it because they're having a job fair there. And so basically, the vaccines are still, I mean, we're still doing vaccinations in public health. Right now, Monday and Fridays, it's at Didido, and Tuesdays and Wednesdays, it's at Inarahan. And then on Saturdays, we're also doing all day down at Inarahan mainly for the 5 to 11 year olds. But, you know, we see that a lot of parents are coming and getting their shots as well with their kids. So we are still pushing that. Unfortunately, we can't do the GDOE that we anticipated to have been done on the 20th. So right now, the only one that's doing that mass immunizations is the one at FD with the American Medical Clinic. Thank you.
Okay, thank you. Thank you.
Thank you, Jerry. Any other questions from our media partners? Okay.
Yes, I have a follow-up question.
Go ahead, Heidi.
To Dr. Bob, you mentioned earlier, Doc, that CDC is coming down hard on public health, thinking that you are already giving booster shots to the general adult population who got their vaccine, who got fully vaccinated 6 months ago, at least 6 months ago for Pfizer and Moderna. But there have been some states like Arkansas, California, Colorado, they've already went beyond the CDC guidelines. They've already expanded their coverage. How come we can't do that here, since we have I think ample supply of vaccines and we're heading into the holiday season?
I'm going to defer to Annette, because Annette was the one, the immunization department was the one that received their call from the CDC.
Yes, thanks, Dr. Bob. So that is a good question. And yes, some states have done it, and they will have to deal with repercussions and consequences from CDC. They made those announcements. And again, CDC has reminded all jurisdictions, you need to stay in compliance with their recommendations, their guidance, because those vaccines are coming free of charge from CDC to the respective jurisdictions. So again, enrolled COVID providers also sign an agreement form from CDC, not from public health, but from CDC, and says it will comply with all CDC recommendations and guidance. So we cannot go off script because we want to do it, and just because we saw another state do it. Those states will have to deal with consequences from CDC. And so that's why CDC put out a reminder to all jurisdictions. We were asked directly as well, are we giving outside the recommendations? And if there are, then we need to remind providers not to do that, because again, we are not complying with what we agreed to, that we are bound to do. So unfortunately, those states, I don't know what their consequences will be, but that is something we definitely are avoiding, because we are sticking with what CDC allows us and is approved for us, just so we don't have to deal with any consequences. So again, we are different jurisdictions, but as a U.S. territory, CDC is our advisory committee, and for safety as well. And so we comply with what they put out. Thank you.
Ms. Annette, when did CDC contact public health about this?
Well, we're always in constant communication with CDC. So we have via email, we have bi-weekly conference calls with them, just as a single jurisdiction. We also have with US APIs. And so these reminders were put out on our one-to-one calls, but also the US API calls that we have with them. Because it's something that they do even when the booster vaccines first came out and people wanted it, or the mixing and it wasn't yet approved. So anytime there's an update or a change to vaccine recommendations for this COVID response, there are some who are eager to open it up to everyone, but unfortunately, we have to comply with what CDC says. And that's why even when FDA approves something, be it a booster or drop of age, we just don't implement it right away, because we always have to wait for CDC to be the final say. So again, it's something that they emphasize to us, as Dr. Bob has said, and reiterating, we must comply with what is approved by them, even though we're seeing in the media from stateside our stateside counterparts are doing their own thing. Thank you.
I have one last question for Annette also. Ma'am, why exactly did they warn us? Was there instances of going against the rules? Was there a whistleblower who called them up about us or anything? Were we the only ones warned, or was everybody warned?
No, everyone was reminded. So Warren, I mean,
Okay.
they asked us about plans about trying to expand like those stateside, because of course there's a ripple effect. When we see another state doing something like that, the question is comes across all jurisdictions. Are you going to follow suit? And they are reminding us that is not allowed. CDC has not expanded it to anyone 18 and older. As Dr. Bob mentioned, they are actually meeting Friday, which is our Saturday. So if they expand it, then we will follow suit. But again, we will have to wait for the information to be actually put out on CDC. Then we will update our standing orders, because then we have to cover our vaccinators. But everyone who is receiving COVID vaccine at the territorial, local, county, state levels are all reminded that we must keep in line and follow CDC recommendations and guidelines and what is approved by CDC.
So there are no violations here that prompted CDC to issue that warning, right?
I'm
no,
not,
no violations here.
so they did not mention that there's some whistleblower as you're asking. They are just reminding us, and that should we encounter situations like that, we will remind our enrolled providers that they must comply with CDC requirements. It's not a public health requirement. This is US CDC requirements.
Okay, thank you.
Thank you.
Yes,
Thank
I also have one more question for Dr. Bob. Dr. Bob, how many patients does the MAB treatment site get now per day?
Oh, I'm sorry, I really don't have that information. I used to work part of the day with the Regeneron clinic, so I could give you a better answer to that. The last time I worked there was about 3 weeks ago. I think at the height, they were averaging around 20 to 25 treatments per day. And I believe that the rate is down to about, I want to say around 5 to 10. But that would be just a guess. I'm sorry. Thank you.
Thank you,
I
Dr.
can
Bob.
get that number for you, Daniel. I'll follow up and I'll get that information for you.
Thank you, Janella.
You're welcome. Any other questions from our media partners? Okay, if none, that'll conclude today's DPHSS COVID-19 brief. Thank you again to all our media partners for joining us today. And thank you to Dr. Bob, Dr. Ann, and Annette Aguon for being here and all the information that they presented and answering our media questions. Thank you to all of our viewers on Facebook Live as well.
I wanted to say one more last thing.
Go ahead.
Again, I want to stress that to our media partners and those that are live streaming this, please, if you qualify, please get your booster shot. If you qualify. And then those that have kids, children 5 to 11 years old, please get your children vaccinated. It will help tremendously in us avoiding surges and get us back to where we want to be with less restrictions, but only if we can accomplish vaccinations. Thank you.
Thank you, Dr. Bob. For the latest information on availability of the vaccines and where you can get them, you can always go to our website at dphss.guam.gov. We have all the schedule of events posted there. So again, thank you everyone for joining us. Have a great rest of your day and great rest of your week. Please be safe. Thank you.
Thank you.
Adios.